Hi, I'm Mina Malik Hussain and you're watching The Coffee Table. So, you know, we always like to bring you these really interesting and fascinating shows, and the fact that I'm on this end of the sofa will give you a hint as to the guests that we have on set today. So today's show is one that is of crucial importance. I know I always say it's very important, but it is really important, and it's something that I hope by the end of the show we will have dispelled a lot of myths. We'll have talked about some really important ways to support each other, language. It's a huge conversation, and this is really just the tip of the iceberg. So today we're going to be talking about autism and autism awareness, and lots of questions that a lot of people have about it and what the spectrum is and so on and so forth. So we're just going to sort of leap right into that conversation. So joining us today on set is Dr. Tanya Soomroo, who is a consultant pediatrician. We've got Maheen Malik, who is a lawyer, but also runs the Lahore Autism Center. And we've got Mariam Haider with us today, who is an educational psychologist. So hello, ladies. Welcome to the set.
Thank you.
It's really great to have all of you here today.
Thank you for having us.
I'm very excited to have this conversation because I have many questions and I'm very curious, and I'll just be like peppering you with things. And I really hope that this is a conversation that I think it's been a long time coming. And I'm really hoping that people watching the show it'll really help. I'm pretty sure it's going to help a lot. So I just want to sort of start at the very beginning. So Tanya, as a consultant pediatrician, you diagnose kids who are on the autism spectrum. So what is autism?
Autism is basically a developmental problem.
Okay.
So it's something where, you know, the signs are obvious in the first 3 years of life. If they're not super, you know, severe, then sometimes kids don't get diagnosed early. They get diagnosed much later. You can even have people who are diagnosed as adults if they're very mild
Really?
symptoms. Yeah.
Okay.
And basically, you're looking for weaknesses in 3 areas.
Okay.
So one area is communication, and that's verbal and non-verbal communication. The other area is social interaction. So things like eye contact, responding to your name, how you interact with others, making friends. You know, so if you're picking up someone later, it might even be something that they don't have any best friends. They're not getting invited to any parties. The parents aren't sure what's going on, but there's a bit of an awkward dynamic maybe. And the third area of weakness is that they have repetitive behaviors and restricted interests. So things like, you know, maybe lining up toys as opposed to playing imaginatively with them, or repeated hand movements, or maybe repeating certain phrases that they hear several times. So it's weaknesses in those 3 areas. And you really have to have, you know, impairments in all 3 of those areas for us to make the diagnosis.
Okay, so it's not necessarily something to start worrying about if your child is very shy, but otherwise is speaking fine and is very chatty at home and, you know, plays with other children and actually, once they get over that shyness.
And you see, and actually the thing is that those symptoms have to be present in many different situations. So it's not that a child is completely fine at home, there are no problems at home, but when they go to school, maybe they're a little bit shy and reserved. You know, that child is unlikely to have autism, you know? With autism spectrum disorder, it's that you can see, parents can see difficulties, teachers can see difficulties, family, friends, family members can see problems.
Okay, so it's that pronounced that it's very visible to people. So, yes.
It can be at times, like Dr. Soomroo said, that at times it's very subtle.
Yes.
So therefore you might not pick up on it. But often enough what happens is that there is a speech delay or something, and parents often feel that, oh, he'll just catch up and it's not a big deal. So I think it's important not to make light of it. And, you know, it's not visible in terms of physically visible, but in terms of interaction and in terms of
so how much of a delay is normal? Because I mean, there's that element that a lot of kids these days do speak later or not as frequently, because apparently the exposure to television and screen time is so much that you don't really need to speak so much. So that's apparently a thing.
I think it's just a delay in speech, because that's what Tanya said, that there's 3 areas to look at. And that too, so if it's just a delay in speech, otherwise, you know, they're communicating well and there are no behaviors, as she mentioned.
And also it's not just a quantitative difference, that there's a delay, there's also a qualitative difference. You know, so it's not just, okay, fine, a regular child is speaking in sentences by 2 and your child is speaking in sentences much later. It's also the type of sentences. It's also the use of language.
Like what? Could you sort of give me an example?
For example, a good example can be social interaction.
Okay.
You know, so a child who's on the spectrum may want to interact, but just doesn't know how. Like a young toddler, you don't have to teach them that, oh, go ask the kid, can I play with you? They find their way.
They figure it out.
They figure it out. Even if when they don't know how to speak, they somehow know that, oh, let's play tag. You know? So with a child who's on the spectrum, they don't know how to do this. So it's not just a delay, it's also a qualitative difference.
And even things, you know, Mina, like for example, if you have a child who has speech delay, you know, that if the child doesn't have any other areas of weakness, that child will communicate very clearly to you what they want. You know, they'll take you by the hand, they'll point to what they want, they'll make motions to you, they'll show you what they want, you know. Whereas a child who is on the spectrum won't be able to communicate that. You know, so they might they might go to a place, they might stand there, they might cry, but the parent doesn't really know, you know, and the parent is handing things and just waiting to see if that's what the child wants.
And often they'll use you as an extension of themselves. Like they'll use the mother's arm to point to something. You know, as opposed to using their own finger, their own arm, they'll take somebody else's, you know, arm and say, okay, this is kind of what I want.
So because they're unable to kind of make that connection themselves, but they do understand that this person can do it for me.
They actually choose, I mean, since talking from my personal experience, they have a caregiver. One person, and it's usually the mother, as I am to my son. And exactly, so when he was a baby, he would just take my hand. I mean, the milk is right there, right? And
okay, you give it to me.
You give it to me. And that is when, that's why at 15 months I knew. And at 18 months we intervened because this was not regular. So you just have to watch those signs, read, and talk to people about it instead of hiding it, which is the most important thing. Because I remember speaking to a friend of mine who was in early childhood education. And she said that, I've been noticing stuff, but people are scared of talking to parents. And
quite right.
So because I reached out to her, and he was only 15 months old, she said, yes, there is something. Of course, I can't label. I'm not a professional in that sense. But you need to do something about this. And the earlier, the better. And so,
So, Maheen, your journey with the Lahore Autism Center began because you have a son who is on the spectrum.
Yes.
And he's 8 years old now.
Firoz is 8.
Yes. And so, from the time that he was a baby, and this is where early intervention becomes so important. So, could you just sort of tell us what early intervention is? I'm sort of laying out all the basic terms so that we're building up a vocabulary as well.
Of course.
That's a good idea.
So, early intervention is anything that is before the age of 3 that you begin it. And there's applied behavioral analysis, which is a bit, one would say people are questioning it these days, whether it is the right approach. But personally, that is the first thing we did with my son.
But what is that?
It is a behavioral science. And it's a proven science, research-based, where you do trials with a child. And repeated trials lead to results. So basically, I mean, asking him, what's this, a couple of times, and then you take data, and then you are able to say that in 90% of the trials, he said the right thing. So this is
he
mastered.
Said circle, so he knew it was
mastered.
A circle.
But of course, then there is generalization, that whether he's able to say that, this is a circle that I'm wearing here, the mic, and various things like this. Then of course, speech therapy, occupational therapy, all this comes together as early intervention. But again, the earlier, the better. Because personally speaking, within 2 weeks of starting therapy, my son had words. And before that,
amazing.
Because there was that right approach that we needed. Right? I'm not saying he became conversational. He's still not conversational. Autism is there and it's going to stay for life, which is absolutely fine. But at least he got to understand that a way of communicating is words. And I, instead of just taking her hand, if I say, he used to say milk. And now he says it in sentences. But so early intervention is in all aspects, from speech to behaviors to their movements, that's occupational therapy, their body movements, bilateral integration, etc. So that's
fantastic. Also, you know, I was going to say that if you think of how much children learn in the first 3 years, you know, that they go from not being verbal to cooing, to babbling, to speaking, to actually speaking in sentences with grammar, you know, correct grammar, sometimes speaking in 2 languages. And so actually I feel like with a lot of parents what they do is that they miss out on that time because they keep thinking that, okay, my child is a little bit behind. It's okay, he'll catch up, catch up. And I feel like in Pakistan what I've seen is that there's this magic number where people will say, oh, by the time they're 6, they'll grow out of it, you know, and then they wait and wait.
Arbitrary magical number.
Yes, and I feel like, you know, the thing is that when you wait too long, then you're looking at a child who is in school age, and then that child is really behind, you know? Whereas when you start it early, it's like a form of tuition. Like I feel like there shouldn't be a stigma attached to it. You know, if your child is a bit weak at maths, take maths tuition.
Yes,
and you'll get better, right? So it's speech therapy will help anyone, you know, anyone who's a little bit behind will get help by the speech therapy.
And I think it's very relevant to speech therapy because even in terms of research and even in terms of biology, there is a window when you're going to learn speech very quickly.
Yes.
So if you miss that window, then the chances of your child making those gains decrease.
Oh, so it's not impossible, but it's just harder for them.
It's harder. It's harder for the parent, for the therapist.
The gap is too big then.
And also alongside with that, let's say you're waiting till 6 or 5, then the child needs to go to school. So not only is speech an issue, there is like school, there's routine, there's structure.
Yes,
there's a lot
there's
more.
Socialization with a whole lot of children who you don't know at all.
So then it's not just one thing, it's like a gazillion things.
Quite right. So at this point, I'm also wanting to sort of talk about how autism is a neurological condition, right? So Tanya, could you explain what that means?
It's basically, when we describe it, we call it medically a pervasive developmental disorder.
All right.
You know?
What does that mean?
What that means is pervasive means that it's present all the time.
Right.
In every situation and every circumstance.
So like Maheen said, it's there forever and it's something you just have to manage.
Exactly.
Right.
And the thing is that, you know, there's a spectrum, right? So, you know, depending on how severe symptoms are, you might be at the mild end of the spectrum or the severe end of the spectrum, right? And actually, if you look at most of us, you know, we'll have some little quirks that may be somewhere on the spectrum, you know? But the point is that none of us are having difficulties because of that, right? So it's only, you know, if you have someone who's, let's say, very shy, but they still have friends, and maybe they were a little bit slow with their talking, but they're talking fine now, they're doing fine in school, you know, then you probably don't need to do anything about that, right? Whereas if they're having difficulties, then you should go ahead and see someone and get them assessed.
And also within the spectrum, you could still be, because there's so many areas that we're looking at. We're looking at speech, we're looking at social interaction, we're looking at attention, we're looking at behavior. So you might vary within that. You could have severe speech issues, but
behaviorally you're all right.
Relatively moderate, let's say, you know. It really varies. So it's not even that you're sort of the same level across domains.
Oh, okay. So competency, or is that okay? Competency, sort of proficiency varies in different areas as well.
Exactly.
Okay, cool. So we're just going to take a very quick break and come back to a really interesting and complex conversation. So stay with us. Hi, welcome back to the coffee table. We're talking about autism, and my magnificent panel is answering a lot of questions for me today. Fun. You know, I always love learning, you know. I'm just like, wow, yes, learning, amazing. So, Maheen, as the parent of a child with autism, and I've been thinking about this, and I was reading about this as well, and talking to other parents who do have autistic kids, it's incredibly difficult in Pakistan especially to be vocal about a condition, and then even well-meaning people feel kind of awkward in the sense that, like, what language do you use? How do you describe it? Like, if you're speaking and you want to be correct and you don't want to hurt someone's feelings or trample on it and say the wrong thing. So a lot of times people don't say anything and kind of sort of fade into the background because then just like, I don't want to get it wrong, so I'll just say nothing at all. So,
I mean, the worst thing they can say is, oh, he doesn't look autistic.
Oh, yeah.
And I'm like, can we just like make a sketch?
What does that even mean, you know? So sort of first off, so should one say a person with autism or autistic person?
Actually, a couple of years ago, I used to say with autism.
Yeah.
And this was when I didn't know the actual stakeholders I was talking about.
Okay.
And very recently, I have become friends with adult autistics and auties, as they call themselves.
Yeah, they call them. Can neurotypicals call them auties?
Yes, absolutely.
Okay.
And I have been told very firmly that we do not have autism because it's not a disease, it's not an illness, we are autistic. Because that is us. Right? So when you start linking it to something that somebody has, you start thinking of possibilities of treating it.
Right. Okay. That there's something wrong. It's like you caught something and then you need to change it because it's just inherently bad.
And whenever you try doing that, you end up either hurting the person, because this is not a disease.
Yes.
You cannot get autism out of an individual. And the thing is that an autistic child is going to grow up to be an autistic adult. And the only thing changing is their age, and maybe some functionality is coming in.
Right.
But they are still as vulnerable, they are still as sensitive, and they still need the same amount of love and hugs and cuddles that a 2-year-old autistic may need. So these things are very important, the way you talk about them. As you were saying, people fade into the background. This has happened many times. I'm very vocal about my son, and whenever I go somewhere, either he has a t-shirt on, which says I'm Feroz, the autism superhero, and that helps us because when he's flapping or he goes up to somebody and touches them, it's fine because it's part of him. But if I hide it, then it's an 8-year-old being odd.
Yes.
So
quite right.
Owning up, not being in denial, gets you the help that your child needs, the love they need, and the accommodation they need.
Right.
So people,
and if you're able to talk about it, then other people are also able to then sort of ask you questions and say, what can I do?
Absolutely.
Sort of how can one help? And I'm sure it's pretty useful for both of you in your practices as well. But Mariam, I'm sure like both of you get a lot of parents who aren't sure what's happening. And I'm sure there's a lot of denial also. It must be incredibly difficult.
For sure there is. For sure there is. Because it is a serious condition. And you know that it is a lifetime diagnosis. It's not going to change. It's not going to go away. And there's obviously all sorts of fears and doubts and how am I going to cope? How is my child going to cope? And also in terms of that one day when I'm not there. And how is life going to continue for my child? So yes, some people go through denial and understandably so. But my concern then just is that the child's time is getting wasted. Because if you're spending too much time just doubting what the professional is saying, then your child is really losing out. And the other thing that I'd like to add is that when people come in and there's denial, or sometimes there are mothers who are quite clear, you know, it's a big step for them, but they're very sure that yes, something is amiss. And we need to have this child tested. I think it's really important for the family members to support the parent. You know, because sometimes there's so much pressure from your family members who are saying, no, you're just worried, kuch bhi nahi hai, and you know,
you're just overreacting. You're over-reading into it.
Exactly.
Like you said, by the time he or she is 6, he'll sort of outgrow it.
So I think parents need support not only from professionals, but they need support from their family members.
And I think it's so lucky that there are places now in Pakistan where you can go for support. And now that there's much more awareness and there are more facilities, I really think about children, like my own peers when I was in school, like many moons ago. And you know how there were kids who were labeled, you know, dumb, or they weren't very smart, and they were slow, and you know, they sometimes had to repeat a class. And now I sort of wonder, well, like, maybe they were dyslexic, maybe they had a learning disability, maybe they were on the spectrum. I just said nobody knew, and we've all just sort of muddled along. So do you think it would be accurate to say that it's not like these conditions never existed and it's only now started happening? It's just that diagnoses are available now.
Both things. One thing is that, you know, yes, that if you look at the American data, I mean, it's, you know,
there's a lot of American data.
Quite an increase in the amount of cases that they're diagnosing. And part of it is because there are better diagnostic, you know, sort of facilities now. And that I think that before, the only kids maybe who were being diagnosed were the ones who completely didn't speak, who were very severely affected, right? Whereas now that even kids who have very mild, very subtle difficulties are being picked up. But there is an actual increase as well. You know, it's not that you can just pin it on the, you know, on the sort of diagnosis.
Why do you think that is?
Because, the thing is that there's not a lot of research about causality. But the research that exists is more about correlates. Like, okay, for the children who may be on the spectrum, so what are other correlates in the environment?
Could you just explain what correlates is?
Correlates is something that also coexists. If A is there, then B is also there.
Right.
But we don't know if B is causing A. if B leads to A.
Exactly.
They just exist together. And if they're existing together again and again and again and again and again, it means that there is some reason, there's some connection between these two things. So there is research, because again, all research is mostly done in the West and in the US especially. So there is this interesting little finding that they're looking at geographical locations. And for some reason, the New Jersey Turnpike, which is a route, for some reason people living close to it is a higher prevalence. So therefore, there is some environmental factor, but we don't know what it is.
Although, do you think, Mariam, also that with the New Jersey Turnpike, what I was also seeing is that obviously New Jersey they have a very good centers for children with autism spectrum. Maybe so do you think that they're there because of that?
They're all there.
Because the data is on how many children are there with autism spectrum, right? So that might also, definitely environmental pollutants, agricultural pesticides, you know, these things have been linked.
Older father.
Yeah, older fathers.
Older fathers, not mothers.
Not mothers.
You know, and definitely genetic disorders. So, you know, in some syndromes, some syndromes are more likely to be linked with autism.
Fragile X.
Yeah, like so there's something called Fragile X, which is actually the most common inherited cause of learning disability, you know? But because your features are not as, like for example, most people will know about Down syndrome and will be able to identify someone with Down syndrome. But with Fragile X, the features are not that obvious, you know? So often kids aren't really diagnosed with it. But so syndromes like Fragile X, there's something called tuberous sclerosis. Those things can be linked with autism. Some drugs that moms can take in pregnancy, you know, so that's why there are a lot of drugs that you aren't allowed to take in pregnancy.
As a mother, I want to just, you know.
Okay, cool. So we're just going to take a very quick break and come back to a really interesting and complex conversation. So stay with us. Hi, welcome back to the coffee table. We're still talking about autism, and now I want to talk about, so Mariam, as an educational psychologist, I'm sure you have parents who come to you and they have concerns about schooling. Like where should kids on the spectrum, should they go to a special school? Should they go to a mainstream school? Can you go to a mainstream school? So,
well, there are many answers to those. The world is moving towards inclusion.
Right.
So that which is mainstreaming. So everybody should go to the mainstream school. And special schools should only be in circumstances and for children where there's no other option. You know, your needs are so intense or your needs are so severe. So yes, I am all for inclusion. And that with your child has autism or your child has ADHD. Because sometimes with autism, you might have other things. So you might have autism with ADHD. You might have autism with anxiety. You might have autism with sensory processing difficulties.
What sensory processing difficulties?
Well, that's a whole new name.
Okay, but this is like a very small nutshell because, you know, again, I want to unpack as many terms as possible because it's good for, you know, the audience to kind of hear
your senses are...
well, all your senses, the way they think about texture or touch or light or sound. So they may react to it differently. So their reactions may or may not be the same as neurotypical children.
Kids,
So that's one element of it. So going back to the schooling, I 100% believe that they should be mainstreamed. And depending on the needs of the child, you customize what is called an IEP. An individualized educational plan. So that child will sit with others who are his age group or her age group. The child will not repeat. The child will socially mingle and socialize with others who are the same. He or she might be following a slightly different curriculum or different assessment process or a different teaching process, you know, but that's about it. But yes, there are situations where I say that, okay, fine, maybe he's not ready for a mainstream school yet. So perhaps put him in, you know, in a special school environment for a short while. For younger kids, we have this excellent system where there are these transition schools. You know, because when they're young and they're having issues with speech and they're having issues with behavior and they don't know how to follow routine, you know, like circle time hai, maths hai, recess hai. So these transition schools are excellent because there'll be 6 kids and 2 teachers.
Oh, that's nice. And then in a really gentle and really focused way, kind of easing you into these kind of more mainstream,
and a morning routine,
neurotypical ways of, you know, going to school. And I was reading somewhere that there is research to show that kids on the spectrum who are encouraged to be more independent, their symptoms actually become more manageable. It's pretty cool. Do you see that? So what do you guys do at the Lahore Autism Center, for example? I know that there's therapy and there's vocational therapy. What is that? Training, okay.
It's vocational and pre-vocational. So that's teaching them life skills. So it's exactly not what we said that they're going to start stitching clothes. Nothing like that.
Vocational training,
not like that.
I'm a mechanic.
You see, for them, vocation is very different. It's living life.
Yes.
That's what vocation is. So literally from using self-grooming to making something as simple as a sandwich, which, trust me, today we made lemonade and it had about 15 steps to it, which we don't even think about.
Yes, quite right.
So we, you know, you make visuals for them. Everything is accessible. Everything is labeled. So every child is able to go open wherever the thing is, take it out. And honestly, they feel so happy and accomplished.
Empowered, you know, I did this.
I did this, exactly. As far as Mariam is talking about the mainstream, I think she's absolutely right because our kids need that exposure. Sometimes what happens is that schools are not equipped. They call themselves inclusive, and they're not. So all they're offering is love. And that's not enough. Right? So a mainstream school should have therapists on board there, on site. If they're saying they're inclusive, they should have a unit for autism, for example. They should have all therapies, everything there. What's happening is that children are going to mainstream schools and in the afternoons, half dead, they're going to therapy centers. My son did that for 4 years.
So you're going through the rigor of a regular school day and then you're going to therapy, which is a completely different challenge.
Absolutely.
So poor kiddos, there's only so much energy.
So they're not kids. They are not kids. They don't have a life. They don't play.
And I think you're very right about it. Schools perhaps being willing to help, but not knowing how to help. And apart from the knowledge and the skill set, I think there's another area which I think is very relevant because a lot of children who come to us at LCC need shadow teachers, you know. So now the issue with shadow teachers is
who's a specialized teacher,
just
is with you, attached
with the child,
to you,
and is meeting the curriculum needs, helping the child meet the curriculum needs, the social needs. You know, so not just the academics, but the problem is there is no training for these shadow teachers. So it's just people who've done perhaps a bachelor's, not even in a related area. So it's not even somebody with a background in education or psychology. It's people who've done almost anything and are willing to do this.
And like Maheen said, they're loving and they mean well.
Nothing bad happens.
Trying to be kind, but like you said, you have to be trained. Like what if somebody with sensory sort of overload is happening and how do you deal with that situation? How do you understand what's happening inside?
Exactly. No, that's a huge area of not having
That's where work needs to be done, to be honest. And that is where, that is where I want to take this further, hopefully with everybody's, input. That we need to change things at policy level and that we are working on some stuff to present at that level and to get facilities for everyone. Not just kids who are coming to, of course, LSC, but for the whole population. Those are our people. Those are my people.
Of course, and the thing is that it's not just children, you know. I'm sure there's so many undiagnosed adults who would still benefit from that kind of specialized support.
And as Mariam pointed out, what when the parents die, that's a main concern. And of course, every night I have that concern. Because of course, family members are there, everyone is there, but you just need to equip your child, number one. And secondly, make something or be sure that there is some place where they will be safe and they'll grow old. Because everyone is not going to be living independently.
No,
even for semi-independent.
Not even sensible or practical to do it.
It depends. Again, as it's a spectrum, it depends.
It varies.
It varies. But you know, where is that place? Right? So that has to change at another level, which is the policy level. So that's the next
And that can only happen if we have enough data, if we have enough qualified people and enough honest people who are able to speak about these conditions, and everybody, either you know someone or there's someone in your family, and it shouldn't be a secret because it's not helpful for anybody. Then you're just sort of confused and alone in your own little bubbles, and there needs to be that kind of interaction. So even as neurotypical parents, there are a lot of sort of myths about being kids on the spectrum also. So like things like oh, you know, you don't want your child to hang out with an autistic child because you don't know what to do, and B, you're a bit nervous that what if my kid picks up something. Yeah, the Paediatrician. Yeah. That's not how it works. That's what Tanya's like, no, it's not germs. It's not contagious. It's not contagious.
Not at all. Yeah. And I think that, you know, as Dr. Mariam was saying, that like at Lahore Children's Center, where we have a very nice little nursery, you know, for kids who are on the autistic spectrum or who have speech delays. And that's basically that sort of transition period to settle them in before school. But even with that, a lot of parents are nervous that they say that, look, I know what my child's difficulties are. I don't know what other kids' difficulties are, and I don't want, you know, my child to now pick up something else. And I feel that, you know, that whenever kids are around other kids, they might, you know, pick up little things here and there, but that's just something that they do temporarily. Like, I think that we all see it with our kids, that they start hanging out with some friend, you know, and that's all a temporary thing. It's not that your child is suddenly going to change
and become autistic.
Yes, you know,
or like start behaving in a way that's not natural to the child.
Tanya's raising a very good point, because that is where the mindset needs to change.
Yes.
That, you know, we need to be accepting of all differences.
Yes.
So, and it's completely okay that one child is behaving in a slightly strange manner, and it doesn't define him as a person.
I mean, just for parents
out there,
don't do, you know, please, in front of your kids. Because that automatically makes your child feel that I'm better. He's, you know, lesser.
There's something
like
wrong.
The bichara
aspect.
Yeah.
Stop with it, because we've done it all our lives. Even when we were growing up, for the poor, we've done it.
Yes.
For the
anybody who's
person
different
with cancer, we've done it. Matlab, we have done it. And consciously educated people need to change the way they speak about differences,
that's a good point.
because otherwise this is never going to change. I mean, take our. There's so many things. India, Pakistan, for example. So in front of our kids.
No, let's not do that.
No, in front of our kids. In front of our kids, don't do that.
Yeah.
Right? Because they are the next generation.
Quite right. And these are
these things.
Yeah, these ideas we start learning at home. And I think that's really important. It's not to. You shouldn't be pitying anyone who's different.
Exactly.
Yeah. No
There's
way.
a difference between pity and love.
Yes,
you know?
and meaning well. And like you said, you know, if somebody learns that Feroz is autistic and somebody doesn't look autistic,
so what are you looking for?
That's a dumb thing to say. Don't say it.
Yeah.
You know, and if you have a question, isn't it better to ask the
come
parent?
to me. I love talking about it.
Yeah, you do.
Yeah.
So that people shouldn't be nervous talking to parents who have autistic children. That how can I help?
Yeah.
What can I do? You know, have a play date. It's fine.
Absolutely. And no, we've had amazing play dates. Thank you to all my friends for that. But another thing we are doing is change misconceptions.
Yes.
It's like we keep posting about those. And there's another thing where
so what
people
are some really common misconceptions?
that they don't have feelings. I mean, they have feelings, trust me.
They're really smart. Like I was reading, again, these are American statistics, but apparently 44% of autistic kids have a perfectly average IQ or above average, which is like any other kid, any other person. They're just as smart. 44% is pretty big.
Yes,
that's a sizable chunk of a population.
Another thing that is changing now is we don't say high functioning, low functioning, because that every child is high functioning and low functioning, if you want to say that, in some respect or the other.
Oh, all right.
Right?
So it's
just like we are. I mean, I don't know math, but I know law. You know, so you'll say she's low functioning in math and high functioning in law. You don't say that.
Oh my God.
You know, so every child, some of them can dress themselves. So you will say, oh, high functioning. Oh, he can't go to the bathroom himself. Low functioning. So these labels, that's another thing.
So we should just get rid of those.
Yes.
And I think the other thing is that I feel that as Pakistanis, we're so overprotective of our kids anyway, right? All kids. And that you will see, you know, kids having difficulty tying shoelaces, feeding themselves, whether or not they have any issues.
Yes,
so I feel that,
that's entitlement.
Yes, I feel that as a parent, you should just try to make your child as independent as possible. You know, these skills of daily living, you know, your child, you should try to get your child to dress themselves, feed themselves, bathe themselves, and don't worry about their, you know, whether they'll do their O-levels, A-levels, metric, whatever, forget that, but make them independent, you know?
Quite right. I think that's sage advice, and the things that need to be worried about is kindness and openness and honesty and doing what's best for our kids, really, in any situation. And which means early detection, asking the difficult questions from your doctor, supporting other family members who might be struggling, reaching out to a friend. And, I feel like it's just being brave in ways, Thank you all so much for being on the show with me today.
Thank you for having us.
Thank you.
Fascinating conversation. And I'm sure that all of my viewers have learned a lot. And the thing here is to be mindful, is to ask questions if you're unsure, and always reach out. We're a community and we're all here. And whether it's kids or it's undiagnosed adults, there is help available now. You know where to go. There are resources available. Ask questions, find out, and just make our lives better for each other. Thank you so much for watching The Coffee Table. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time. Bye now.